Who knew how the world would be turned upside down in 2020? COVID changed our outlook, our care delivery systems, our models of care. How could such a small thing that we cannot even see change the world as we know it? Staffing was disrupted. Workflow and processes were disturbed. Socializing became taboo. Families were torn apart. Human touch became something that was feared, although still craved. All things that the human body needs to thrive. Loneliness and worry began to take over. Residents missed their families. Mental health challenges became more and more prominent in both residents and staff as everyone fought to overcome the virus. We banded together, did what we could to raise morale, keep each other safe. Our therapy teams lent a hand in areas outside their usual roles when they could. Service delivery methods and group class formats changed. Everyone rose to the challenge of fighting to keep some sense of normalcy despite the limitations forced upon us. We all learned how to protect ourselves and those whom we served through proper hand washing and the use of PPE. Virtual care platforms were rolled out for therapists, while assisting our on-site support teams with their in-person care delivery, avoiding gaps in therapy services, all the while responding to the ever-changing surroundings together with the interdisciplinary team. We made use of technology and created virtual exercise classes. Everyone quickly became familiar with telehealth platforms as a solution until in-person visits could resume. Still, the most powerful piece of all was, and always has been, the power of touch. That human component that brings with it feelings of comfort, healing, love. Every little bit helped. A smile, holding someone's hand, a reassuring greeting. We all desperately tried to bring hope back into the homes. We stood as one and rose together, recognizing the healthcare heroes in our midst, those who sacrificed and kept marching on, always taking a moment to touch those around them however possible, however they were allowed. And as we started to gain the upper hand on the pandemic that shook us from our comfort zone, we realized that the keys to success were in being able to adapt and to be innovative. Hope returned, as did the realization that there is light at the end of the tunnel. We would emerge from this senseless feeling of doom and gloom. Solutions were on the way, things that would bring us back closer to the life we once knew and enjoyed. We continued developing our in-studio exercise program called Ageless, providing an activity, guided exercise, and lifestyle e-streaming service to help support those who cannot access in-person care. We support Canadian suppliers and companies when possible, and despite the pandemic lasting longer than we could have imagined, Novo continues to grow, uplifting to the NASDAQ public board, expanding our borders beyond Ontario, beyond Canada, and creating a new research and development sector focused on virtual technology and nutraceuticals, all with the goal of providing quality healthcare and delivery services. As life starts to regain some sense of normalcy, social and group activities resume, limitations resolve, we realize that we have survived. And quality care continued without a hitch. We continued to provide that personal, human touch and are re-engaging in more in-person care, having weathered the storm and avoiding gaps in service through our technology and virtual approach. And from this, we all emerged stronger. Together, we did it. At Novo Peak Health, we are people caring for people. We provide therapy and allied health products and services for the elderly, both in homes and in the community. We are so proud of our teams and the teams in all of the homes for their dedication and service. You made the difference. You are our healthcare heroes.